the exam council members used to be called senior examiners, and they were more experienced examiners that would come to the exam, but we've gotten them more involved in the process of, editing questions, picking questions, constructing the exam. And it's a really good thing because the board can focus on more strategic things. But then the other thing is it gives the board members an opportunity to see the exam council members at work, which allows us to figure out who should progress in leadership, rather than it being based maybe on reputation or who knows who. It's can be more performance-based, which is great, and it's also a great opportunity for people to get to know each other and work together. And these retreats have been nice because we used to do the oral board exam in person, and, we would have all the candidates there. We'd have all the examiners, the senior examiners at the time, the directors, and it was a great experience. It was very tiring, and it was a great networking opportunity. And then we went to the virtual exam, and we kind of missed that interaction. And having these retreats, this is the third retreat that we've had here, has created an opportunity for us to separate the actual administration of the exam to the creation of materials in a more relaxed environment where, the content creators, the curators, and the directors can all interact with each other in a setting where, people get to know each other, and we can really spend more time helping the younger folks understand how the organization works and what we do. And so I think it's been really great. Everyone's a volunteer who's involved with the board, and there are 4 levels. Either you're a task force member who's writing questions for the various certifications. You're an examiner, which, is someone who's giving the exam, and then an exam council member who's someone who's giving an exam, but also, helping with the task force members writing items. And we have a whole structure for each certification that involves exam council members and directors. And then the directors are the highest level. And so it's a nice progression. There's a lot of opportunity, and we have such a great specialty with so many phenomenal people. And so it's nice to be in this environment where you can get to know people you maybe didn't know. In the past, what we did is we constructed hypothetical cases, frequently based on real cases, and we would present those to the candidate, and then they would have to work their way through this hypothetical case. It was very standardized. There was a pathway that we expected them to go through, and it worked, for many years. We're transitioning to more of a case-based exam based on the actual candidates' practice and looking at their practice patterns, getting feedback from their peers in the community, and then actually testing them on what they're actually doing in practice. And so they do that in several other surgical specialties. And I've had the opportunity to go watch the orthopedic surgeons do this. And I think it's a very interesting and worthwhile way for us to evaluate, what people are doing. We're doing the standardized cases. They're very pattern-based, and our people are very smart, and so they can usually figure out what the pattern is. And, we're only able to test them on a limited subset of things, and it may be things that they do or don't do. By doing a case-based evaluation where we're looking at their actual practice, we're able to evaluate what they are actually doing and ask questions about why they did things and ask them about their judgment and really examine what they're doing in practice. And so I think that is something that will allow us to examine people at a higher level, in terms of rather than just recognizing patterns and knowledge, really analyzing their performance in practice. I think the rationale for it is good. I think that most people take primary certification shortly after they finish training, but then they may go on and practice for 20, 30, 40 years. And I think what the intention is that if you finished in 2005, we don't want your knowledge to stop in 2005. I think patients expect physicians to stay current and to, know what the latest and greatest is and know what the standards are, and things are constantly changing. In the time I've been in practice, the standards have changed quite a bit. And so the purpose of continuing certification is to make sure that physicians are staying up to date and staying current with the knowledge base and the different techniques and things that we do. So I think the intention is really good and is the right thing for the public, which is who we serve. Our specialty is small, but it's diverse. And we've made a big effort to try to customize the evaluations to the specialty that people are actually practicing in their practice. And so I think it's been popular, and I know, I participate in it, and I look forward to receiving the questions and looking at them. And some of it is knowledge that sometimes we purposely put things in there that are new that we don't necessarily expect people to know, but we think it's important. If a good example is if a new drug comes out that might have some implications for anesthesia. And so, there's so many different drugs, and, it's hard to know all the drugs, but it would be important to know one that maybe needs to be stopped before anesthesia. And so we can highlight those things so that people become aware, through this process without penalizing them in any way.